Today's topic is the anatomy of the mandible. We have to learn the bony features and the attachments of the various muscles and ligaments and the structures related with the mandible, the nerves, arteries, and the ligaments. So this is the norma frontalis, and here you see this is the mandible. Its body is horseshoe shaped, and it forms a lower jaw, hosting this lower teeth, and it forms a joint with the skull, which is the temporomandibular joint. So in the midline, there is the symphysis manti. In the neonatal skull, the mandible has two halves, which are united by symphysis, and later these ossify and one bone is formed, a complete mandible. And in the midline, there is the mental protuberance, triangular impression elevation. This is a mental protuberance, the infralateral margins of which are called as the mental tubercles. This is the mental protuberance, a triangular projection in the midline, and infralateral margin is known as a mental tubercle. So we have to study the mandible by dividing into two parts. This is the body, and this is the ramus, the two rami. One ramus, other ramus, left and right, and this is a pair of rami. You could see this is the body, this is one ramus, this is the lateral view, this is ramus, and this is body. So these are the various important features over here. This is our body, and this is ramus. Body is studied by dividing it into outer and inner surfaces. This is the outer surface of the body, and this is the inner surface of the body. It has two borders, upper border and a lower border. The lower border is known as the base, and upper border hosts this teeth. It is known as the alveolar process, and there are present the lower teeth in that. So I've told you about the symphysis manti, about the mental protuberance and the mental tubercles. Now we come to the oblique line, very important. This is the continuation of the anterior border of the ramus. This is ramus, it has an anterior border. Its continuation below to the body is known as the oblique line. It runs forwards and downwards, reaches the mental tubercle. So this is the oblique line. And here you identify already it's a groove for the facial artery. And on the inside of the body, there is very important mylohyoid line. This is the mylohyoid line. Posteriorly, it starts below the level of the third molar. This is the third molar teeth, and from here it starts, runs downwards and forwards, and reaches this symphysis area. The symphysis area. This is the mylohyoid line, and at its end there are the various tubercles. 4 of them, upper and lower genial tubercles of the mental spine. Upper genial tubercles and the lower genial tubercles, the mental spines. The mylohyoid line divides the inner area of the body into upper and the lower parts. The upper parts, the sublingual fossa, and lower is the submandibular fossa. Of course, these are related with the glands, which is the sublingual gland, and this is the submandibular gland. Also the parotid gland, this is on the lateral aspect over here. This is the parotid gland. So all the 3 salivary glands are associated with mandible. So this is the various aspects of the inner view of the body of the ramus. This is digastric fossa. The base at its anterior end has a fossa near the midline. It's the digastric fossa. And now let's study the ramus. The ramus is a quadrilateral structure. Quadrilateral, you see. Quadrilateral, 4 parts. It's a quadrilateral structure. Yes. So which has a 4 borders and 2 surfaces. And surfaces are the outer or the lateral, and the inner or the medial. This is the surfaces of the ramus. And the borders are the anterior, thin border. This is anterior, which continues below as the oblique line. Then is a posterior border. This is thick, and it has a lower border which continues to the base. Then this lower border of the ramus with the posterior border of the ramus unites to form the angle. And the upper border forms a mandibular notch, which has a coronoid process at the anterior end, which is a triangular flat structure. This is coronoid process, triangular flattened structure projecting upwards from the anterior border of the ramus of the mandible. And then is the condyloid process, which is from the posterior border of the ramus, and it has a head and a neck. Head is expanded in all directions. It has an articular facet covered with the fibrocartilage, and this makes the temporomandibular joint articulating with the temporal force of the mandibular force of the temporal bone. This is the temporomandibular joint formed by the head articular surface. Below is the constricted portion, this neck. And on the inner aspect of this coronoid process, there is the depression on the anterior aspect. This is the pterygoid fovea. This is pterygoid fovea on the anterior aspect of this head. This is pterygoid fovea. And now is coming to the inner aspect of this ramus. We have a mandibular foramen. We have a mandibular foramen, which runs into the mandibular canal, which is not shown here. Mandibular canal runs into the substance of the bone. So this is the mandibular foramen. And anterior to that is a projection, which is the lingula. Then is the mylohyoid groove. Anterior to this mandibular foramen, it runs downwards and forwards till here, right? From here to this here, which is the level of the third molar here. And lateral to that is attachment of the medial pterygoid. This is a area for the attachment of the pterygomandibular raphe and the superior constrictor. Pterygomandibular raphe and the superior constrictor. This is another view of the mandible. This is superior and this is posterior. You see at the posterior view that this is in the midline. There are present this is the posterior part of the symphysis menti, which also a groove, median groove, which upper part has the superior mental spines or the tubercles, and lower part has the inferior mental spines or tubercles. This is the view, right? And this is a superior view where I want to show this retromolar triangle below the third molar. So this is the area of attachment of the pterygomandibular raphe. And here is the very important mental foramen on the anterior aspect. Anterolateral is that view. This is mental foramen. This is located below the second molar. Below the second molar is the mental foramen. Now the attachments which is present over here, the four important muscles of mastication are attached to the ramus. Their insertion is onto the rami of the mandible. We'll discuss one by one to them. The muscles are temporalis, masseter, lateral pterygoid, and the medial pterygoid. And now you see anteriorly, this is the muscle which is the mentalis. There is the incisive fossa, not visible. This is attached to the incisive fossa. Below the incisor teeth is the incisive fossa, to which is attached the mentalis. And this is the oblique line, which upper part gives attachment to the buccinator. And below to the oblique line are attached this depressor anguli oris and this depressor labii inferioris. And this is the attachment of the platysma on the lower part. This is attachment of the platysma. And this seventh is the lateral pterygoid in the pterygoid fovea. Lateral pterygoid, one of the muscles of the mastication, is attached to the pterygoid fovea. And this blue outline, this is the Limit of attachment of the oral mucous membrane. This is the teeth, this is the oral mucous membrane, this is the lower limit. And green is the capsular attachment of the temporomandibular joint. And two muscles are left over here, and this number 8 is the masseter. This attached on to the lateral or outer aspect of the ramus. And this number 16 is the temporalis. This is to the coronoid process, its anterior aspect, and to the ramus anterior border on the outer and inner aspects, upper part. This is the posterior view. Here is the ligament, very important, which is a sphenomandibular ligament to the lingula. This is the lingula. It has attachment of the sphenomandibular ligament. And this is the stylomandibular ligament attached to the angle of the mandible. This is the pterygomandibular raphe to the retromolar triangle. This is the medial pterygoid onto the medial aspect of the ramus. This is the medial pterygoid. Then this number 5 is the genioglossus, and number 6 is the geniohyoid. These are attached to the superior and inferior genial tubercles. This number 11 is the mylohyoid over here to the mylohyoid line. This is the mylohyoid. And to the digastric fossa is the anterior belly of the digastric, to the digastric fossa. This clearly shows the attachment of the masseter. This is the ramus outer aspect, and barring its upper part, posterior part, to which the parotid gland is attached, all this part is of the lateral aspect of the ramus. There is the attachment of the masseter, the muscle of the mastication. At number 16, I told you already, this is temporalis attached to the coronoid process and the anterior border of the ramus. This again is the buccinator. This again is the platysma. This 4 is the depressor anguli inferioris. This number 10 is the mandalis. I've already told you. This number 13 is the pterygomandibular raphe. And this number 7 is the lateral pterygoid in the pterygoid fovea. This last picture of attachments again shows this temporalis and this lateral pterygoid in the pterygoid fovea. This again is the pterygomandibular raphe and the superior constrictor. And to the mylohyoid groove, this is the attachment of the mylohyoid muscle. And this is the medial pterygoid, the medial aspect of the ramus. This is the digastric fossa giving attachment to the anterior belly of digastric. Here are the muscles shown. This is temporalis and this is masseter, attached or inserted into the lateral aspect of the ramus of the mandible. There are few muscles shown in elaboration where the neck is fully extended, hyperextended. This is mandible, and this is the anterior belly of the digastric coming from the digastric fossa. This is mylohyoid coming from the mylohyoid line, and this is the geniohyoid coming from the genial tubercle. Then the structures related with the mandible are very important, some very important nerves, very important vessels, and some glands I've already told you, and the ligaments. We'll study the nerves first of all. Here you see this is the mandibular notch, and here is the masseteric nerve and vessel to this notch, masseteric nerve and vessels. Then this is the mantle foramen. It has the mantle nerve and vessels coming out of that. Mantle nerve and vessels emerging from the mantle foramen. And this is the angle, and anteriorly this is masseter. And here emerge the facial artery and facial vein, and this is the facial nerve. Various these neurovasculature. You see, very important, this is the facial artery. So this is anterior to this masseter. You can feel the pulsations. It comes from inside down here and ascends to this part of the mandible, forwards, upwards, This is the facial artery related over here. So this is the thing. Onto the inner aspect, you see, this is a auriculotemporal nerve related over here to this part below the this coronoid process. This is the auriculotemporal nerve. Then this is the inferior alveolar nerve, along with its vessels. They run in the mandibular foramen, in the substance of the bone. I'll show you later in another picture. They are running into the mandibular canal. So then is the mylohyoid nerve and artery running into the mylohyoid groove. This is the mylohyoid nerve and artery. So these are the nerves. Then vessels, again, this is the superficial temporal artery and this is the maxillary artery. These two important arteries are also related with this part of the mandible. This you see, this is the mandibular foramen and this is the canal mandibular. So here it runs into the substance of the bone, this inferior alveolar artery, and gives the mental branch. Very important nerve, inferior alveolar nerve. Here it comes and it is entering the mandibular foramen into the mandibular canal, running in the bone of in the substance of the bone, and emerges here in mental nerve. It's a branch of the inferior alveolar nerve. Now, and finally, some ligaments. You see, this is the temporomandibular joint. It has a lateral ligament. See this? It is attachment to the neck of the mandible. This is the neck giving attachment to the lateral ligament. And over here, this is the sphenomandibular ligament coming from the spine of the sphenoid and inserted into this lingula. This is the attachment of the sphenomandibular ligament to the lingula. And then is the stylomandibular ligament from the styloid process of the temporal bone to the angle of the mandible. This is the stylomandibular ligament. These ligaments are attached with the mandible. Then very important, there are age changes in the mandible. This is the mandible of a child. This is of the adult. This is in the old age, which is the edentulous mandible. In the child, this is the mental foramen. Mental foramen is low, close to the lower border or base. So this angle is obtuse, about 140 degrees. And in the adult, this mental foramen shifts upwards and lies midway between the upper and the lower borders. And this angle is about 110 degrees. And in old age, this again becomes like the child. The mental foramen but shifts upwards, and there occurs resorption of these bones, and teeth are gone. And this is the edentulous mandible. So old age mandible is much similar to a child mandible. Few words for the fractures of the mandible. It can be fractured at this canine triangle. This is the fracture over here, fracture line. This is the angle, and in front of that, this is the molar teeth and this fracture. Interrupt that. And fracture can also occur at the neck of the mandible. This was few words about the bony feature, the attachments of the mandible, the various muscles attached to that, the ligaments related with that, and the nerves related with that, arteries and veins related with that, and the glands related with that. Thank you very much.